Our case study is on Adam, and he has myocardial infarction and coronary artery disease. This project is by Jessica Pack and Jennifer Waldman.
Coronary artery disease develops when the major blood vessels that supply your heart with blood, oxygen, and nutrients become blocked with plaque. When plaque builds up, they narrow your artery and decrease the blood flow to your heart. Symptoms of coronary artery disease include chest pain, shortness of breath, and a heart attack. Some causes of coronary artery disease include smoking, high blood pressure, diabetes or insulin-resistant diabetes, sedentary lifestyle, and radiation therapy to the chest for treatment of certain types of cancer.
Myocardial infarction is also known as a heart attack. The heart requires a constant supply of oxygen and nutrients to the body. If one of the arteries of the heart becomes blocked, it causes the heart to become starved with oxygen, which leads to a myocardial infarction. Adam is a 56-year-old Caucasian male. Prior to his myocardial infarction, he was independent in all his daily life function. He is a highly successful executive for a technology firm. He has been married for 31 years and he has 2 sons, one son away at college and the second is a junior in high school. His wife, Janine, works full-time as a chief financial officer for a chain of retail stores. Adam and his family live in a large 2-story colonial home in the suburbs with 4 bedrooms and 2 full baths upstairs and a half bath and living areas on the first floor. He can enter the house from the garage up 5 steps, and once inside he must manage a long flight of stairs to get to the second story. Adam loves golf and sail, and he takes his family on 2 vacations a year to pursue these activities. He wakes up early and comes home late. He drinks large amount of coffee and smokes 2 packs of cigarettes a day. His father died at the age of 62 of a heart attack. Adam is a driven man who expects everyone around him to excel and extend themselves to the fullest. He works on average 70 hours a week, and he enjoys his lifestyle and his roles as a worker and father the most, although he spends little time with his family. He is a confident man and states that he doesn't let difficult situations get to him. Adam denies that stress is a factor in his life and says that he thrives on challenges. He is planning to return home immediately following his hospitalization to work quickly as possible.
Adam was brought to the emergency room by his wife after complaining of chest pain, indigestion, and heartburn that had been going on for several hours. He was admitted to the coronary care unit with a diagnosis of myocardial infarction and coronary artery disease. Adam's myocardial infarction is of moderate nature with damage to the heart evident on the EKG. Additional diagnoses include gastric ulcers and tendinitis of the elbow. Adam has not had a physical in years and has no documented history of heart disease.
Upon evaluation, some assessments were performed. The mini-mental state exam was performed to assess cognition. The range of motion was assessed to see the motions in his joints. And we also wanted to see what his independence were in his ADLs. And so we used the functional independence measure to assess those levels. The Borg scale of perceived exertions will be used throughout to measure his exertion levels during the activities that he does in therapy.
Adam is evaluated 1 week after his myocardial infarction. He is evaluated on the coronary care floor, not the CCU. Adam presents with no deficits in cognition, perception, sensation, vision, or hearing. He has active range of motion within normal limits with good coordination. He is left-handed. His strength is not tested due to his cardiac status but appears functional for current tasks. He has significant deficits in endurance with his sitting tolerance out of bed only 5 minutes. He can transfer from the bed to the chair and from sit to stand with contact guard. Supine to sit requires minimal assistance and his bed mobility is independent using bed rails. He can ambulate without devices and walk short distances such as from the bed to the bathroom. Currently, he is independent for ADLs and IADLs.
The delivery of services will be provided by the occupational therapist or the occupational therapy assistant. It will be delivered in either the patient's room or the rehab gym. It will be performed for 45 minutes in the morning to perform morning ADL routines and 45 minutes in the afternoon in order to work on endurance and sitting tolerance. The frequency will be 5 days a week, and therapy will last for 1.5 hours. Adam is employed full-time as an executive for a technology firm. He is more than likely to have healthcare insurance through his employer. We will need to look into the specifics of coverage in relation to treatment, available services, and discharge.
We chose to use the biomechanical frame of reference because Adam has limitations in endurance and high levels of fatigue, so we wanted to focus on improving ADLs to improve his functionality. We also chose the establish or restore approach to restore endurance and prior level of functioning and dressing. And we also chose create and promote to enhance his performance in dressing.
So currently, the current level of Adam's performance is that he is dependent on dressing activities. So we wanted to have a long-term goal that addressed his dressing activities. So the long-term goal is, by discharge, patient will be able to perform upper body and lower body dressing with minimal assistance while sitting at the edge of the bed without verbal cues. His first short-term goal would be within 3 treatment sessions, patient will be able to perform upper body and lower body dressing with maximal assistance while sitting at the edge of the bed. Short-term goal 2 is within 6 treatment sessions, patient will be able to perform upper body and lower body dressing with modified assistant while sitting at the edge of the bed with no more than 3 verbal cues. His third short-term goal would be within 9 treatment sessions, patient will be able to perform upper body and lower body dressing with minimal assistance while sitting at the edge of the bed with no more than 3 verbal cues.
For the dressing intervention activity, we would first focus on preparatory activities to increase Adam's activity tolerance by having him participate in edge of bed activities. Next, we would work on purposeful or occupational based activities and would have Adam perform upper body and lower body dressing by using energy conservation techniques to conserve energy and reduce excessive movements. The next problem area we chose was work. We chose to use the biomechanical frame of reference to improve his endurance by increasing his sitting tolerance. We are using 3 different approaches. First, we're going to use prevent to prevent further deconditioning from inactivity. Establish and restore to restore endurance and prior level of functioning in order to so that he can successfully engage in work activities. And create and promote in order to increase Adam's performance at home and in his work environment.
Adam has significant deficiency in endurance. His sitting tolerance is only 5 minutes out of bed. Therefore, we wanted to address his endurance and his goals. His first long-term goal is, by discharge, patient will be able to perform tabletop activities independently for 60 minutes at a time to be able to successfully return to work. His first short-term goal is within 3 weeks of sessions, patient will be able to perform tabletop activities independently for 20 minutes at a time to be able to successfully return to work. His second short-term goal is within 6 treatment sessions, the patient will be able to perform tabletop activities independently for 35 minutes at a time. And his third short-term goal is within 9 treatment sessions, the patient will be able to perform tabletop activities independently for 50 minutes at a time to be able to successfully return to work.
The preparatory activities we chose to address work include breathing exercises and increasing Adam's endurance by performing low-intensity, time-specific exercises with breaks. We also chose purposeful or occupation-based activities like performing dynamic sitting balance exercises during tabletop activities by reaching and grasping objects.
Adam will be educated on how and when to incorporate these breathing techniques during his activities. The first step would be to inhale deeply through your nose for 4 seconds. And then the second step would be to exhale through your mouth through a count of 5 seconds. And he would have to repeat these 3 times. The anticipated discharge setting is home. We recommend him a home evaluation to assess how his home environment will affect his performance ability, especially his work environment. We also want to give his family some education packets in terms of home exercise and caregiver instructions for Adam.